Good afternoon, everyone. This is Dr. Moreau with Cause de l'École. As indicated earlier, we change our time to Sunday from 3 p.m. so that way we can ensure that we provide you with this information on Cause de l'École. I'm going to go ahead and invite some of my friends here so you guys can join me. And I hope that you will share this video with everybody else so that way they can also benefit from this invaluable information. So I'm gonna go ahead and invite a few more people, and then I will go ahead and begin today's information. So today I'm going to focus on avoidant personality disorder, which we're going to call AVPD, avoidant personality disorder, which is AVPD. What is that? So AVPD is really a mental health disorder involving chronic feelings of inferiority. Chronic feelings of inferiority or inadequacy. Okay, so that's what avoidant personality disorder really is. It's a mental health condition involving somebody having chronic feelings of inferiority or inadequacy. So what are the characteristics really of avoidant personality disorder? So when we look at the characteristics, we see that these people tend to be timid. They are socially hypersensitive. They have intense feelings of inferiority. They have fear of rejection. They seek unconditional acceptance. They usually have very close relationships. They are self-effacing because they go out of their way to please others. So they put themselves last. They always put other people first because of fear of being rejected. So what are the signs that tell you somebody have AVPD, which is avoidant personality disorder? What are the signs? So these people, they avoid occupational activities that involve significant interpersonal contact. They are unwilling to get involved with people unless certain of being liked. They show restraint in intimate relationships because of fear of being shamed or ridiculed. They are preoccupied with being criticized or rejected in social situations. They view themselves as socially inept, personally unappealing, or inferior to others. They are unusually reluctant to take personal risk or engage in new activities because those activities may prove embarrassing. So people with these characteristics, you can tell that they have an avoidant personality disorder. So what could cause somebody to have an avoidant personality? What are the causes? So traits of social anxiety, self-consciousness, shyness, and inhibition are not enough to cause AVPD. Manifestation of persistent thoughts of inferiority and irrational cognitions can also be causes. Family control and overly critical of a child may also cause that child to not fully develop social skills, causing them to develop a limited social competence. So when that happens, that child will end up having avoidant personality disorder. Because of their fears of rejection and humiliation, people with AVPD, they often have issues with employment. The interpersonal fears may lead them to accept job positions below their competence level. They accept job positions below their competence level because these low level positions may require little social interactions. So they prefer to take a low level job because of low social interaction instead of accepting a position that meets their competence level. This is somebody that has an avoidant personality disorder. Are there any treatment for people with AVPD? Are there any treatment? So there are two major, I would say 2 to 3 major types of treatment for people with AVPD. The first two are behavior therapy or cognitive behavior therapy, which is CBT. So behavior therapy include gradual exposure or systematic desensitization. Gradual exposure or systematic desensitization. The second point is interpersonal skill training. And third, guided imagery. So those 3 components are all under behavior therapy. The second type of treatment is cognitive behavior therapy. What does that entail? Cognitive behavior therapy help replace the client's automatic thoughts to counter self-criticism, negative prediction, maladaptive assumption, and misevaluation of other reactions. So cognitive behavior therapy help replace these automatic thoughts of self-criticism, negative prediction, maladaptive assumption, and misevaluation of others' reactions. Cognitive behavior therapy or CBT also focus on increasing those people's emotional tolerance and reduce avoidance. So cognitive behavior therapy also focus on increasing those people's emotional tolerance and reduce avoidance. So those 2 types of treatment, behavior therapy and cognitive behavior therapy, are really the 2 types of therapy, the 2 major ones that your counselor will do with you in order to treat your avoidant personality disorder. So what about medication? So medication may aid in overcoming fear and anxiety. So as we know, those people have fear and they also have anxiety. They also deal with low self-esteem. So medication may aid in overcoming fear and anxiety as they are sometimes reluctant to continue treatment because of the lack of interaction that they tend to avoid. So this is in large an overview of avoidant personality disorder. So we went over a few of the characteristics of it, the symptoms of avoidant personality disorder. We went over some of the treatment, the causes, and some of the treatment of avoidant personality. So if you know anyone dealing with avoidant personality disorder, if they are unwilling to get involved with people, they show restraint, they have low self-esteem, they are preoccupied with being criticized, they have fear of rejection, they self-efface so they can go out of their way to please other people, they tend to be timid, right? So all of those signs are of people with avoidant personality. And again, family control, overly critical of a child, may cause that child to grow up having avoidant personality disorder. If you do know people with those signs of avoidant personality disorder, encourage them to seek treatment, so that way the people treating them can give them relief, so they can help them deal with the thoughts, how to interpret the thoughts. Again, cognitive behavior therapy will help them replace those automatic thoughts, right, to counter the self-criticism that they have, the negative prediction that they always have, the misevaluation of others' reactions. Behavior therapy, which will help them gradually or systematically reduce desensitization, interpersonal skills training that they will receive, and guided imagery. So all of these will be part of treatment to help them deal with the avoidant personality disorder. I want to say hi to my wife who's watching. Rimaj, thank you for coming and watching. Please share this video with your friends so they can also benefit from this information regarding avoidant personality disorder. So next Sunday, I will go over our third personality disorder, and I hope you'll be back and share this time with us. Once again, enjoy the rest of the Sunday. Have a blessed week. See you next Sunday. Take care.